Welcome back. You are listening to the Maria Mukunda show on Salam Media. And this is the Tuesday edition. Thank you for choosing Salam Media as your broadcast of choice. Millions of people across the world wonder and doubt if children can get depressed. We have questions like, but what do they have to be depressed about? When we were their age, we were happy and we did not be depressed. There is such a misunderstanding and stigma of depression in children. So, to talk more about this topic, let's welcome Dr. Razina Muhammad, who is going to shed some light. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Razina, shukran for joining me.
Assalamu alaikum. How are you, Mariam? Jazakallah for having me.
Alhamdulillah, shukran, and it's a pleasure. All right, so what do we know about depression in children? Because as I mentioned in the introduction, that we view it as there's no need for children to be depressed because they're young and they don't have all of this weight on their shoulders and they're supposed to just be kids and play. So, what do we really know about depression in children?
So it's a very common misconception that kids don't feel depressed or anxious at all, but many children have fears, worries. Some of them may feel sad and hopeless from time to time, especially children who have genetic predispositions to depression or anxiety, meaning one or both parents or even grandparents may be diagnosed with anxiety and depression, are susceptible to being to grow up and be depressed. And it's very difficult for parents or even teachers or anyone that interacts with kids to identify when they might be anxious or depressed. I think it can be hard for parents to tell when is the difference from just general sadness or just general fear and anxiety, and when it is actually clinical in nature.
All right, so let's discuss that a bit in detail. How can we, as parents, identify a depressed child or a child who has anxiety or any other mental illness?
So there are usually a few areas that I would say one needs to look at when dealing with children. Some of these areas include their sleeping habits. Other areas include their eating habits, their toilet habits, depending on the age as well. So it's important to take consideration how old they are, and also just the relationships they might have. So if they're going to school, or if they interact with family. So looking at their behaviors in those specific areas. So some of the ways, if we look at the eating behaviors, if they say in nursery school or primary school and you notice that they're eating less, or perhaps they are not eating at all, there's a change in that. We call it the black hole. This is the opposite of where they don't eat, they overeat. So where they're just eating all the time. So those are some red flags you can look for in eating patterns. When it comes to sleeping patterns, if they're not sleeping well enough, they're having nightmares possibly. For younger children, perhaps 5 to 7 years old, you might find they become more clingy, so not wanting to sleep alone. Then with toilet training or toilet patterns, you might find that bedwetting might occur in some kids, or even mistakes, as we would call them, whether it's at school or at home. And then the opposite, if they're not wanting to actually go to the toilet. Then just general behavior changes that you might find, where they become very quiet, so retreating into themselves, or you finding that their friendships are being impacted, so not wanting to develop and play with their friends, or defiant behavior is also a very common symptom that we see in children with anxiety and depression.
So basically, pretty much like many adults, some of
Yes.
the signs are they're similar. Now, from what age group do children start getting depressed?
So some research shows that children aged between 3 and 17 years can be diagnosed with depression.
Mhm.
It's very hard to diagnose kids with depression and anxiety between the ages of 3 and say perhaps 9, 8 or 9 years old, because they haven't yet developed enough language skills to be able to express how they're feeling. And so, if we just go back to what you mentioned, that a lot of the symptoms look like the symptoms that one would see in an adult. As a parent or as an adult or caregiver of a child, think about how do you feel when you're depressed? How do you respond to those feelings? And can you then imagine for a child who has probably very limited understanding of their emotions, how they may not be able to express what they're feeling? And so then it's up to you when you see these noticeable changes to be able to normalize it for them and to exploit a little bit more. And also, as a professional, I'll say this that, and I tell parents this all the time when they bring kids in for therapy, you're still the parent. So you would know in your heart of heart if something's wrong with your child, and your gut will always tell you something might be going on, and you just want to explore that a bit more.
All right. We are talking depression in children with Dr. Razina Mohammed. If you have any questions or comments, you may leave them in the comments section. Dr. Razina, what about contributing factors? Are there any contributing factors to depression in children?
They can vary depending on the context. So, like I said, one of the biggest things is genetic predisposition. Oftentimes, when we see parents, one or both parents who have a history of depression, kids are more susceptible to that. Parenting methods, so things like the context of the home, is there abuse going on? Is the child being taken care of in the best way possible? Other common things that we're seeing nowadays is bullying happening at schools. That is leading to a lot of kids feeling anxious and depressed. I think a lot of kids also it's very difficult for kids to recognize when are they being bullied. So it's also, again, up to parents to being able to recognize when is your child being bullied. Are they avoiding wanting to go to school and addressing the bullying that's taking place? Other issues or other things that may contribute to kids feeling depressed or anxious. Sometimes it could be a comorbid disorder, if I can put it in that way. So oftentimes, a lot of parents can confuse ADHD, for example, attention deficit or attention hyperactive disorder, for depression or anxiety. These kids can come across as depressed, but generally it's just the depression or the anxiety is a symptom of not being able to focus and them not being able to understand why they're having difficulty in that way at school. And then also we're seeing now with the current context like COVID and a lot of change. So when there's poor stability in the home, we're seeing kids coming up with showing a lot of symptoms of anxiety and depression.
Okay, so how do you know if your child needs treatment, and what treatments are available?
So with kids who are suffering from anxiety or depression, or if you feel that there's something going on with them and you need more insight, it's if you're finding that you're just struggling to make sense of the child's mood or them sleeping, or simply I can put it, if the functionality of the child. So children's main function between, even if we're saying if it's the ages between 3 and say 10, their role in the world is to play. If they are not playing, if they are not being children, and you find that you as a parent is struggling to understand why this is happening or why they're not meeting milestones, then I would say consult with a professional and they can do an assessment or have a one play therapy session to do a clinical assessment and then being able to give you feedback and seeing is there something more that can be done. Just to mention as well, one of the other symptoms we often find with school-going kids is a decline in their school performance. That's also a very big symptom that something else is going on.
Mm-hmm.
And
All
then,
right.
yes, in
Yeah.
terms of, you mentioned what are the possible treatment plans. So
Mm-hmm.
depending on the severity of the depression or the anxiety, we often recommend play therapy. So these are sessions, like I said, the role of a child is to play. We give them a space, a very safe and confidential space where they can play or act out their feelings in the space where there's a professional to help them understand their feelings. And sometimes we do conduct psychological assessments to get more insight, to see if there are any underlying disorders. And if needed, depending on how severe the disorder might be, we would recommend to a psychiatrist or a neurologist to intervene from a medical perspective. So perhaps considering putting kids on medication.
Mm-hmm. Now, I was just going to ask you whether kids would have to take antidepressants or not. And if so, in what form do they come in? Because I know we struggle to give our kids medication, even vitamins. Now, having to take antidepressants, that's also something that's going to be challenging.
Yes, definitely. So some of the other things we recommend before we would even go the medication route. Going on medication is quite a serious and it's a big decision to make. So as a psychologist, I don't want to give too much recommendation on the medication side because we don't work on that so much. But we would first encourage things like changing the eating plan, so making sure that they're being nourished well, helping them participate in physical activity, making sure they're getting the recommended amount of sleep each night. And then also just including a lot of mindfulness exercises, relaxation techniques. So working on things like that, helping them finding coping mechanisms to manage the symptoms of the anxiety. In terms of the medication, it can range, I think, from perhaps daily dosages to in various different forms, but more information on the medication itself would be better answered by a psychiatrist.
Mm-hmm. And what happens if depression goes untreated in kids?
Usually, when depression and anxiety goes untreated, you'll find that they become susceptible then to other disorders as they get older. So things like adjustment disorder. So meaning as they get older, not being able to fully develop or meet their milestones, whether it's learning how to communicate with others, learning how to deal with stress, learning how to overcome general life challenges. And so if we can look at the extreme and we can see things where kids then become non-functional members of society, so engaging in really bad behavior, to where they then not focus on school, dropping out of school, not having appropriate goals, and not meeting the requirements that one would need to be functional in a community.
One thing that we need to realize as people of color is that depression is real. We often just brush it off and say, they're probably just going through a phase and there's nothing like depression or anxiety. And we often look at it as like perhaps you don't believe in God, and then your faith is not strong enough. But then when you see kids who are depressed, what do you say to them? Is their faith not strong enough as well? They're just kids, so how would they know
Yeah.
anything about having a strong enough
So
faith?
that is definitely one of the cultural difficulties that in specifically in our community that I would say
Mm,
we deal with a lot. And I think it's about explaining that, you know, depression and anxiety, it's not just about how one is feeling. We know now there's a huge movement because there's a lot of research that's showing how the mind and the body is connected. And so, oftentimes, and this is why we then do professional assessments to be able to see is the depression, anxiety maybe coming from a physiological issue in the body? Even, for example,
mm,
something like ADHD, there is a biological issue. There's perhaps an imbalance of chemicals or hormones. Or if we look at the history of the child, perhaps the pregnancy was not the best of pregnancies, or the first few years of the child's life was not, maybe there was a lot of stress in the home. All of these, there are so many factors that contribute to how a child may be feeling. And remember, if we're talking about kids, their reasoning skills in their first few years of life is quite limited. So
mhm.
we can't also then blame them and say they don't have a good understanding of religion, so their religion is poor. Yes, we should definitely have faith that Allah will help get us through a depressive episode or help us to feel more functional as we get older. But we also have to consider the decisions that we make and how we raise children, the parenting methods that we implement that can contribute to disorders like this. I think one of the most difficult things working with kids is working with parents who may not be open to the idea that their child could be depressed or anxious. And I would recommend, remember, kids look to parents for is this safe and having an understanding of what's going on. So if we can get the buy-in of a parent, then we can help the child to the best of our abilities.
Okay, and Dr. Razina, for parents who are watching and listening, where can they get help?
There are many different avenues that one can get assistance um, from nonprofit organizations. So things like places like JPCCC, Family Life Center, and also if you just using things like Psychology Today, you can find many referrals from educational psychologists to counseling or clinical psychologists who would be able to see children dealing in these with these particular difficulties.
All right, okay, we're going to leave it there for now. Thank you so much for the chat and for joining me today. Have a lovely day. Assalamu alaikum.
Jazakallah so much. Wa alaikum salam.
That was Dr. Razina Mohammed talking us through depression in children. It is real, it does exist, and do look out for the signs and symptoms of a depressed child. If your child does inhibit some of those signs that Dr. Razina mentioned, then take them to a clinical psychologist for evaluation, and together you can help your child beat depression. And it's not something that you know just well, it is something that just happens, but it's not something that cannot be beaten. You can beat depression, but you need to take the first step and make the first move into recognizing, being aware of the problem, and going to seek help. Just stay with us. We will be back after the break.